in sticking with the gutting of social services, I found this story from Colorado that talks about how cuts to Medicaid will ravage these some of these communities within Colorado. I know that Medicaid, Medicare play fantastic roles in the lives of the elderly, the disabled, and the poor. I was on Medicaid for 2 years. I didn't make enough on the books income to qualify for, private insurance. So I was on Medicaid for 2 years. I used it one time. I got one physical, but I think it's great to have. I think that the some of the extensions of the Affordable Care Act. By the way, I work on tips, so I'm not like, hiding money from the government, but like my taxable income was not enough to qualify. But I think it provides a fantastic service, a necessary service, and I think that instead of shrinking these agencies, we need to expand them. So this is courtesy of CPR News. Republicans are aiming for deep Medicaid cuts. Here's what folks at One Colorado Community Health Center think of it. Was written by John Daly. Dozens of people gathered at a Stride Community Health Center clinic in Aurora Friday to hear their representative in Congress, Democrat Jason Crow, deliver an ominous message. He told the crowd that without vocal public opposition, Republicans could well slash federal funding for Medicaid. That's the $880 billion a year state federal program, which covers health care for 1.2 million people in Colorado, about a fifth of its population. Folks who've received care thanks to the program described the potential impact of deep cuts as disastrous. Quote, "It's been life-saving to me because I've seen family members of mine die from complications of organ failure due to diabetes," said Jean Cisneros, a Lakewood resident who described herself as a grandma, sixth-generation Coloradan, and diabetic. Quote, "I didn't want that for myself, but I didn't have any health care." Something to consider, and we are going to talk about this point a little bit in depth. Conservatives look to cut these programs on the justification of them being bloated and inefficient and them requiring more money to run than private insurance. The reason why, yes, these companies require more money is because they treat people who require either more care or additional care, like old people, at least on Medicare, and then disabled people on Medicaid. You can't do a straight up comparison like that with private health insurance. It's not an apples to apples comparison. On a per capita basis or on a per person basis, these programs are just as, if not more efficient than private health insurance, which tracks back to the structure of private health insurance. All of the bureaucracy at your insurance company is what jacks up the price on your goods, your services, and your treatment, as well as the profit motive. A budget plan congressional Republicans released earlier this month aims to cut spending and boost funding for border enforcement while enacting up to $4.5 trillion in tax cuts. Many conservatives and Republicans view the Medicaid program as inefficient, expensive, and too big. President Donald Trump said last week in an interview with Elon Musk he would not touch Medicaid, but he has endorsed the budget plan. But Cisneros said many people will lose healthcare altogether, severely hitting community health centers and the broader health system if Congress passes deep cuts, she said, describing both community members and patients of the Aurora Clinic. This is nothing new. Millions of people lost healthcare under Donald Trump's first term, and millions of people lost healthcare once the COVID extensions were taken away. There was no reason to boot these folks off of their healthcare. And again, it's not just individuals on these programs as well. You have families, young children who need healthcare, who are only able to get healthcare through programs like this. If it wasn't for Medicaid, a lot of these people, they wouldn't be getting any healthcare. Cisneros said it's not fair. Rep Crow said Rep Crow told the crowd Medicaid is a vital part of the U.S. healthcare system, imperfect as it is. It's not even imperfect. The imperfection And the perceived inefficiency comes from the fact that these programs are not sufficiently funded. The VA, the VA is socialized medicine for veterans, and that is one of, if not the most popular programs in the country, and it works exceptionally well. If Medicare and Medicaid were ran like the VA, nobody would have anything negative to say. And even though they're not, and they may be quote unquote a little bit more inefficient, people who receive these services through these programs are overwhelmingly positive in their response towards it. He called the push to severely cut funding for the program stupid, which it is. It's beyond stupid, but I understand this guy has to use PG language. Quote, not everybody is in the position of having private health insurance, he said. We have a badly broken health industry in America, badly broken. So what happens here is the front line of healthcare in our communities. It's not like these folks, at least the low income earners, are not working. And the disabled people may or may not be working because they're unable to. But even if they are, there's a chance, a very likely chance, that their job does not offer them adequate benefits or does not even offer them health care at all. And they could be working 30, 35, 40 hours a week. The system is so insidious. It is set up to work against you actively if you're a poor person in the United States. And as we know, the poorer you are, the lower your life expectancy is. Because not only do you have the mental stress, the mental toll that it takes on you being poor, of not knowing if you'll be able to make rent, not knowing if you'll be able to feed you or your family that night. It's the physical toll as well, not being able to get care, not being able to afford care, even for something like the flu, right? You can go to urgent care, as I did, if you catch it early enough and be prescribed Tamiflu. That could potentially help with your complications, if hopefully you don't receive complications, but if you do. But think about that. If you do go on to have complications, you may not be able to pay to go to the ER. It is such a sick, twisted, and depraved system. It is beyond dystopian. On a tour of the clinic and in remarks at the press conference, clinic leaders and staff described the positive impact Medicaid coverage has on its patients, as well as the danger imposed by possible cuts. Stride is a federally qualified health center. Staff said its mission is to provide comprehensive, compassionate care to everyone, regardless of their ability to pay. Quote, Medicaid is essential to that mission, said Dr. Megan Adamson, Chief of Medicine for Stride Community Health Center. Every day, Medicaid allows children, seniors, people with disabilities, and working families to get the care that they need without having to choose between their health and their basic needs. Doctors provide care because they want to. They don't provide care to make money. The insurance company seeks to make money off of you meeting with your doctor. Medicaid, again, Medicare, removes the profit motive from the equation. It's only administrative costs to operate, I believe it's Medicaid, compared to whatever the fuck for your private insurance company, where it gets marked up like, I don't know, 1/10 of a percentage point for every person that the claim has to go through. And there's like 3, 4, 5, 6, 7 people that see this claim, or that maybe don't see this claim. You just let it sit. It's sick. She said it covers preventative services, chronic disease management, mental health care, which is huge, and life-saving treatment that many could not afford otherwise. Even like having a chronic condition like asthma or diabetes it's insidiously expensive. And these clinics provide a valuable and necessary service. Quote, without Medicaid, our most at-risk neighbors would face devastating health outcomes, and our entire health system would bear the burden. Delayed care leads to more emergency visits, higher costs, and poor health for our communities. This tracks, well, obviously this tracks, but even if you're a healthy person, you should still be going to the doctor for an annual physical, because preventative care is preventative for a reason. It allows you to catch any underlying issues before they bubble up and become out of control. But I want to touch on this part right here. The first quote that I mentioned: health outcomes in our entire system would bear the burden. We already are bearing the burden. The United States spends twice as much per capita on healthcare spending than every other developed nation. And we have, across the board, the worst outcomes in the world among these developed nations. We are seeing life expectancies decline, while other countries like Canada, Japan, Italy, Germany are having their life expectancies reach the early to mid 80s. That is both physical and mental. There is by no measure that the United States collectively, overall, that the healthcare system is the best in the world. There may very well be certain cancer hospitals and certain like cardiology facilities that are the best, and I'm not like trying to downplay the American healthcare system. It is great if you're able to afford it, or if you're in a position to have good enough insurance. But it's not humane to paywall these services. But when people have access to primary and preventative care through programs like Medicaid, she said they stay healthier, remain in the workforce, and contribute to their communities. Quote, healthcare is not a privilege, it's a basic human right, and Medicaid is one of the strongest tools we have to ensure that right is upheld. Rep. Crow was asked what community members could do in response to Republican efforts to cut Medicaid. Crow said they should not be silent or unwilling to mobilize and activate the community. Quote, speak up, don't be afraid. There's a lot of fear right now, right? Because let's be honest, there are people who want us to be afraid so they can do whatever they want, and I refuse to give them that power. Stride serves 55,000 patients at 13 different sites across multiple counties, and the impact of the loss of funding would depend on how deep the cuts go. If they're substantial, then Colorado will have to drop a lot of people from Medicaid as well as optional services like long-term care and home services, Adamson said. Quote, a substantial part of our budget is from Medicaid, and so we would do everything we possibly could not to close our doors, but we operate 13 different sites, she said. It could mean closing sites and really severely cutting costs, which would mean that quite a few people would lose services across the system. I don't know the specifics of these facilities, but in rural America, regardless of where you live, if you do live in rural America, finding a clinic could be virtually impossible. Or you might have to drive 35 minutes to your closest hospital, right? If we think about Cuba and Fidel Castro, I know, very controversial subject here in America. One of the things that Fidel Castro did upon coming to power in Cuba was he made sure that every town, every community had access to a healthcare clinic. And he would make the doctors in Cuba serve in these clinics to these underserved populations. Still to this day, Cuba has a very robust healthcare network. They have, I think, more doctors per capita than any other country on the planet. It is a commitment to providing healthcare. People in the rural United States of America should have similar opportunities to get treatment. On tour of a clinic, Crow asked Rosario Morales, the clinic's manager of program enrollment, what would happen if Medicaid funding for patients is cut. She said it would mean more misery and lives cut short. Quote, here's what's going to happen. They're going to stay home. They're going to fall ill. They're not going to want to go to the hospital and accumulate the huge bills. Quote, they're not going to have money to go. So they're going to go to the hospital when there's nothing left. She said hospitals will have to pick up the financial burden of care in the end. These patients don't have a way to pay 50, 60, 70 grand worth of care in a hospital. So what's going to happen to the bill? Who's going to pay that bill? There's no way. We're going to lose lives. Who pays that bill is people who pay into private insurance. I feel like this fact is not well known enough. Because if it were, there would be nearly unanimous support for Medicare for all. When you pay a premium, when you pay into your insurance company, that money goes in a pool. And at a certain point, that pool is used to wipe out outstanding debt. It functions the same way as a taxpayer-funded system would, except it is marked up by at least twice as much. So these unpaid bills wind up being paid by you, the insurance holder, just at a larger rate. Bernie Sanders put this argument really eloquently. It's a pretty famous clip of him on Fox News. He says that if you're paying $5,000 a year in taxes, but have $10,000 a year in healthcare costs, Medicare for All would raise your taxes to $8,000 a year, definitely, but you're still saving money. You're still paying $2,000 less. And you don't have any surprise healthcare costs on top of it. You won't have to get a bill in the mail. Your taxes will fund your treatment. You may have to pay out of pocket for a prescription, like $5, $10, whatever it may be. It's just, if you want to not discuss the humanity of a system like this, the necessary humanity for a system like this, talk about it economically, because both arguments are indisputable. Medicaid patients are by definition often low income and from traditionally underserved communities. Physician's assistant Bryn Montalvo, the new medical director of Stride's Peoria Clinic, said she wasn't sure those communities will be able to push back against the cuts. Quote, "They don't have the resources to speak. They feel like they don't have the resources or they don't have the knowledge of what is out there to help them and give them a voice," she said. Having a congressman advocate for these people is essential because it gives them a semblance of knowing that somebody is out there to represent them, and then maybe they will have more awareness of the resources to speak out. I found this study as well from the Center on Budget and Policy Priorities that, by the way, this is a nonpartisan think tank, by the way. A switch up from our usually conservative think tanks that ultimately reflect the same opinion that I do. Not an opinion. It's not an opinion for them. They're studying it, but whatever. Medicaid works. Millions benefit from Medicaid's effective, efficient coverage. Now, this is from 2017. Virtually nothing is unchanged, or nothing is changed, because the system is still the same. The only thing that's different is the amount of money being put into these programs. But Medicaid is unchanged from when this article was written. What do we have here? Medicaid improves health. Research shows that Medicaid improves health across a variety of indicators. For example, one research study compared Arkansas and Kentucky, which have adopted the ACA's Medicare expansion, with Texas, which hasn't. Okay, so this was when states, keep in mind, I was not of the intellectual capacity to understand the Affordable Care Act at this time when I was like 20 years old, because I was a fucking idiot. This was when states didn't have to automatically opt in to these Medicaid expansions, which of course only serves to fuck the people in these states. In the expansion's first 3 years, the uninsured rate among the group eligible for expansion coverage dropped by more than 20% points more in Arkansas and Kentucky than in Texas. In Arkansas and Kentucky, the expansion fueled a 29% increase in the share of people with a personal doctor and a 24% increase in the share of people who received a checkup in the last year. With greater access to care came better outcomes. Medicaid expansion resulted in a 42% increase in the share of people who said they were, quote, excellent health. Mind you, this may be a little exaggerated, but let's just say it is. To even be able to make that claim, you have to have been seen by a medical professional. A doctor has to assess your well-being, and they could say, yeah, you're in excellent health. You're great. Keep doing your thing. In Arkansas and Kentucky, Medicaid expansion has made people more financially secure. The share of people having trouble paying their bills dropped by 25%. Here's a chart for if anyone's watching this. Medicaid also produces long-term improvements in health and well-being. For example, among African American children, Medicaid eligibility during early childhood reduced mortality rates in their later teenage years by 13 to 20%. In addition, research published in the New England Journal of Medicine reported that expansions of Medicaid coverage for low-income adults in Arizona, Maine, and New York reduced mortality by 6%. Likewise, the expansion of Medicaid and other health coverage in Massachusetts in 2006 significantly reduced mortality, especially deaths from causes affected by healthcare. This was when Mitt Romney was governor as well, by the way, which for anyone who doesn't know, Obamacare is basically just the healthcare plan that Mitt Romney instituted in the state of Massachusetts. It's not a very progressive healthcare reform, but it's a good enough reform for there to be actual benefits. Other studies show that children eligible for Medicaid for more of their childhood earn more as adults and are likelier to attend and complete college. In contrast, the AHCA's cap on Medicaid funding would undermine Medicaid's positive effects on health by shifting significant costs and risks to states, placing beneficiaries at serious risk of losing their Medicaid coverage entirely or access needed to services. Mind you, this is probably most likely red states who already have issues funding a lot of their programs. They do get a lot of funding federally. Medicare provides access to care that is comparable to private insurance. Evidence does not support claims that Medicare fails to provide access to providers and high-quality care. Medicaid beneficiaries have access to healthcare services that are comparable to, but less costly than, what they would receive from job-based coverage or individual market coverage, with healthcare quality at least as high as private coverage. Mind you, kind of a low bar. Private healthcare coverage is not that great unless you do have a really good job. But still, everything that has been fed to you, all of the propaganda that has been fed to you about Medicaid and about these programs, it's a fucking lie. There are studies upon studies upon studies that illustrate the efficacy of these programs. One important measure of access to care is the proportion of people with a regular healthcare provider. Surveys show that Medicaid beneficiaries have a regular healthcare provider at rates comparable to people with private coverage and are likelier than people with private coverage to say that their care was excellent or good. And this is because everybody hates their insurance company. Everybody. If you find someone who has Aetna or Blue Cross Blue Shield and they're like, no, I love my private insurance company, they are the executive of that insurance company. Because normal people fucking hate dealing with these corporations. It's not just how infuriating it is to dispute a claim, it's the anxiety of not knowing what's going to be covered. It's the anxiety of not knowing if they're going to misinput your service potentially and you wind up getting a bill. I'm actually in a dispute with my insurance company right now because I believe that I was wrongfully charged for an EKG when I went for my annual wellness visit. It's $75. It's not the most grand expense, but it's the principle of the situation. The insurance company should not be allowed to unilaterally decide care that is necessary and care that is not. They are not doctors. They are insurance people. They may have doctors in those companies, but they're not providing care to these patients. A doctor working with a lawyer to draft the terms and conditions of your healthcare contract with your insurance company does not know your specific situation and the specific needs that you have as a patient. Medicaid beneficiaries are also less likely to forego seeing a specialist when needed than people with private insurance or those who are uninsured. And compared to the uninsured, Medicaid beneficiaries and people with private insurance are much likelier to get preventative services and likely to have an unmet need for behavioral health services. Medicaid is efficient. Medicaid spending per beneficiary has grown more slowly than private insurance. This is a chart. Average annual growth rate per enrollee, 1987 to 2015. Medicaid is at 4.1%. Private insurance is at 6.9%. Medicaid is much more efficient and cost-effective than private insurance. Adults on Medicaid cost about 22% less than if they were covered by private insurance after adjusting for differences in health status. This is, again, because of the bloated bureaucracies that make up these health insurance companies. Medicaid also provides more comprehensive benefits than private insurance with significantly lower out of pocket costs to beneficiaries. Medicaid, it's all dependent on where you stand in relation to the poverty line. And that's what dictates the services that you get and the services that you will have to pay for. The lower income you are, the more likely you are to qualify for free coverage, which I think is a great thing. Because if you're making $25,000, $30,000 a year, going to the doctor or like having an operation is a serious expense that you in all likelihood will not be able to afford. Over the past 30 years, Medicaid costs per beneficiary have essentially tracked costs in the healthcare system as a whole, public and private. In fact, cost per beneficiary grew more slowly than Medicaid than for private insurance between 1985 and 2015. That was the figure I just looked at. I'm not going to read the remainder of this because I don't think there's any more explaining that I have to do. It is just so fucking stupid that we are stuck in the most dumbass fucking healthcare system possible as the richest country on the planet. This is like dystopian level shit that we deal with.